I've been here since 2007, and the staff is great. I mean, we've got some very professional, very caring people here. The thing that impresses me most about this office is just how organized everything is, how on board the entire team is. Our focus is to make sure that our patients have the best experience that we can. We try to really pamper them and to spoil them. We're always looking forward to trying to find new ways in order to make them more comfortable for their appointments. And I think we do a pretty good job at that.
Anxiety, can you talk about your comfort items you offer and maybe your approach to someone who's scared to even step foot in the front door?
One of the things that I learned in my continuing education was how to handle patients who were afraid of being at the desk. As a matter of fact, I even taught some seminars on that. And the biggest thing that I can tell someone who's afraid to come to the dentist is that you're not alone. We understand. I myself don't like going to the dentist. I will shake, I will tremble, I will sweat the whole 9 yards when I'm at the dentist. And so if you're like that, please come on in, give yourself a chance. Let's find out what we can do in order to make you feel more comfortable. And what I hope for my patients, that step by step, that for each dental visit they have that's a positive experience, it's going to make the next one easier for them. And we've had patients who we literally had to sedate to have them get their work done, and now they're getting their work done without having to be sedated. We've just built that confidence up, appointment by appointment.
That's great.
Yeah.
Okay, so moving into the specific things from your services, can you talk about mini implants and dentures, and who the ideal candidates will be for those kind of procedures?
Mini dental implants are a great way to take care of loose and ill-fitting lower dentures. One of the worst things about losing your teeth, especially, is to lose your lower teeth, and your lower denture does not stay where it needs to stay. Every time that you chew, every time that you speak, it's bobbing up and down, it's kicking back and forth, and it's going to be a hassle, and it's going to be a potential source of embarrassment because you don't want it to come out. What mini dental implants do is a very minimally invasive procedure, is to place some basically little buttons for the denture to snap onto. It makes it a lot more secure. We can do it in one visit, and we can make a huge improvement in someone's quality of life for that, because we eat every day.
Yeah. So, but that procedure has come a long way. Can you talk about what patients can expect when they come in for a root canal?
Absolutely. Root canal is a scary word. A lot of people don't like to hear it. My goal is to have the patient sit up at the end of the appointment and say, wow, that's it, you're done. That makes me feel good. And that's what kind of experience I'm looking for people to have. When you have a root canal, you're going to be numb, and we're going to make sure that we get you just as numb as we possibly can. And I always tell patients, if you start to feel anything, let me know first thing. We'll stop and we'll figure out what we need to do in order to get you comfortable. And we do. Once the initial appointment is done, we've gotten the nerve out of there. It's going to be sore for a day or two, but usually patients who have been in pain are significantly improved. Then, if we haven't finished the root canal procedure during that first appointment, we'll bring them back in a few weeks after, like the infection has had time to clear up or whatever needs to happen, and then we'll go ahead and get them numb again, finish their root canal, and usually we'll start the crown then to save them an appointment. So, we try to minimize the number of times that we see patients so that they don't have to take off work, but we also try to make sure that they're as comfortable as we can make them while they're here, because no one likes to come back to the dentist if they were hurt.
Absolutely.
Yeah.
So we covered them. You had mentioned
dentures.
Dentures. Okay. Can we talk about dentures?
Sure, absolutely.
Yeah. Can you talk about the services you offer?
Yeah. After I graduated dental school, my first job was to go and work in a denture clinic. So literally, I did thousands and thousands of dentures. We did anywhere from 15 to 25 dentures a day. So I was able to gain a lot of experience right off the bat in how to do dentures. Now, I took what I've learned there and I've improved my techniques, and now we're doing dentures here. I've had patients that have had some really horrible looking dentures. I had one lady who had when she smiled, you could see almost nothing but gum because her denture was way too tall. The dentist who did that denture, who made that denture for her, just didn't know what they were doing. So we took that, gave it back to the patient, said, we're going to make you something new. And when we finished with her, she was a lot more comfortable. She was able to eat a lot better. She had pain in her jaw joints from that denture. The one that we did immediately solved the problem. And, a good fitting denture is almost becoming a lost art nowadays. We just don't learn much about them in school. I was fortunate that after I got out, after having done my 2 dentures in dental school, that I had a real crash course on how to do them right, and had lots and lots of practice doing them.
Well said.
Right.
Forward in the future, you might offer sleep apnea services.
Mm-hmm.
Is that something you'd want to cover on video, just so we have it on hand later when you do offer it?
I can talk some about it.
Okay.
And then if we offer it, great. If not, that's great.
Yeah,
All
that's
right.
the idea. We have it on hand just in case.
Yeah.
Okay. Can you talk to us about sleep apnea? Yeah.
Sleep apnea is a huge problem in the United States, and I've suffered with myself, so I've got some firsthand knowledge on what it's like to wake up in the morning, you're still tired, your throat's sore because you've been snoring all night, and you just feel run down all the time. What a lot of people don't realize is that in addition to keeping your partner up at night, you're also really doing a big disservice to the rest of your health. You're going to have cardiac problems with that. You're going to have high blood pressure problems with that, obesity. I mean, there's a lot of things that are tied to sleep apnea that people just don't understand. The other thing is that a lot of people don't realize that they're doing it. And so, one of the things that we do is we do ask people if they've had issues with snoring, if they've had issues waking up with a dry mouth, or even problems with their jaw joints. Those are all indications that they may have a sleep apnea problem. We work with a sleep specialist who can treat the apnea, and what we do for the sleep specialist is to offer a jaw repositioning device. And what that does is that without the use of masks typically, and sometimes we still need a mask too, but people don't like to wear those, but we like to have something to push the jaw forward a bit that opens up the airway, and it takes care of the apnea problem for some patients. And for those patients who it's a good fit for, it's a great service for them. Then, of course, we work with the sleep specialist who's going to monitor them long-term to make sure that the appliance is working the way it's supposed to. And then we monitor the appliance to make sure that it's fitting the way that it's supposed to.
Excellent.
Right.
Okay. What patients can expect when they come in for a dental cleaning or exam for the first time here?
Okay. A lot of patients come in and they expect that they're going to get a cleaning the first day. We do if we can, but typically we don't. And the reason for that is because we're more interested in providing the right service for people, not just to do a cleaning. A lot of patients that haven't been into the dentist in a long time usually have gum disease. And we want to make sure that we're not letting that slip by, because that can have some serious consequences down the road. You're going to meet one of our hygienists. We've got great hygienists here. I've had every one of them work on me, and they are painless. They're amazing. They're going to take a look at your gums. They're going to take a look at your teeth. We're going to get a full series of x-rays. We're going to get a full series of intraoral pictures, and we're going to be able to share those with you so that you're going to understand your condition. Because it's up on the screen, we're going to explain it to you very thoroughly. Once you understand what's going on in your mouth, then we give you some options as far as what we can do to address those. And it's up to you to figure out what you want to do, how much of it you want to do at a time, and how quickly you do them. My job is just to make sure that you understand what's going on and what sort of treatment I would recommend for you. And in the case that we do have treatment to do, if we can get it done that day, we try to do that for patients. But we'll also make sure that before we go forward that you understand everything that's going on, how much it's going to cost, or what your insurance should cover, so that you understand fully what's going on before you make a decision.
Great.
Okay.
And in your
Well, I think the technology that we have in this practice is outstanding. The way that we're able to visualize what's going on in your mouth and help you understand that is top notch. The other thing that sets us apart is that we care about what your experience is here. We want to make sure that it's as brief as possible, because we know you all have busy days to get on with, and that we're working around your hours too. We offer early hours, we offer late hours that a lot of dentists don't, because we know that people have to work, and we try to be available for our patients. One aspect of dentistry that both Dr. Monroe and I have both had a lot of extra training with is more complicated cases. If we have someone who's neglected their mouth for a long time, but they want to keep as much of their natural teeth as they can, we have the training to make sure that when you're done, you've got a healthy, comfortable bite that's going to last a long time. And frankly, that's not the sort of thing that you learn in dental school. You have to go out and get extra training to do that. And both Dr. Monroe and I have had a lot of extra training in that area.
Good.
Okay.
Good.